Want to see some crazy stuff?
Yes.
Where do you guys work? Which department? Emergency, but peds or adult? Both. Okay. Okay, so now this is very important for you guys. Do you draw blood from your IVs?
Yes.
Good. You can. Now, what's the trick to not hemolyzing?
Don't get tourniquet on for a long time.
Why does a tourniquet cause hemolysis?
I have no idea.
It doesn't necessarily cause hemolysis. It does give you falsely elevated levels because of what we call hemoconcentration. There's too much backup. Your blood doesn't back up for that much volume of blood, so you get this high elevation of electrolytes. Maybe some hemolysis from pressure, but it's really the hemoconcentration of all the electrolytes and other materials in the blood. What else?
Going too hard.
Too hard. What's too hard?
We use one side syringe.
The syringe.
Is it the syringe? Or is it you?
Both.
100%. You have to own up to your own mistakes to do better. Absolutely. In the ER, you know what I did?
Yeah.
Right?
Yeah.
I thought if I pull harder and hold it there, maybe it'll come out better because I want to let it know what I want, right? That hemolyzes the blood. If you pull more pressure than what's in the veins, you're gonna collapse that vein. So let's play around to see how hard you actually aspirate blood. What's your normal aspiration? Ooh, interesting.
What'd she say?
She says it might be stronger. Interesting, huh? What happened here? Now I want you to do it again. I want you to pull at this, and I'll show you guys, and you're more than welcome to play around with it yourself. I think it's very important for you to actually quantify what you're doing. This changed my practice. Okay, where was she at before? With the 10cc? It was past 3. Now try it with this one. This is why we aspirate with 3cc syringes. This is the key. It is not just the syringe, but it is also our effort. She's maintaining sub 3. Now, just because it's a 10cc syringe does not mean you'll always pull it hard. It depends on how hard you do it. It's up to me, and it's a lot harder to pull gently with a 3cc syringe. Look at how much I'm moving that syringe. I'm moving it. You can't tell because it's very gentle, right? So even with her 3 milliliter syringe technique, I'm able to pull with less pressure. I'm still able to aspirate blood properly like you would with a 3cc syringe. So it's about your effort, right? So I want you guys to practice with this so you can see how hard you're actually pushing. So now, knowing this, you can either get the right tools or use the right technique to decrease your likelihood of hemolysis, right?
So it's about pulling gently.
Oh yeah.
Oh yeah.
What happens when I suck on that tube?
It expands. No, closes.
If I suck it in, it closes. If it closes, there's no blood.
Right.
I can't pull. So you need to give time for blood to get there. Now, what if I put in a big old fat 18 gauge? What's gonna happen?
Wow.
You can pull it immediately after you insert, but after what, 30 minutes? What happens?
Collapses.
There's no blood flow. Blood goes this way and we just block it completely. So this is why our IVs can't draw blood, because we're putting in too big. Now, of course, if they need rapid transfusion, keep them alive, right? We'll find other ways to draw blood. However, if they don't need it, do we really need a 20 gauge? How about a 22? Right? So this is going to show you aspiration technique of how you're doing it and help you improve, so you can get a feel for, oh, this is how little pressure I need to apply. So that's what this one's for. This one is to show you how hard you're flushing. 106. Anybody changed tires before?
No.
Nobody? Wrong crowd. How much does one tire that holds literally over 1,000 pounds of pressure, how much does one tire have? 40, 45. 35 to 45. This is why we tell you not to flush with the 3cc. How come you drew with less pressure?
Because I'm in peace and we always do that.
But how come this had less pressure than when we're flushing? Ah, Because pressure, the potential energy is unlimited. It's limited by you and me. But the potential energy of aspiration is limited by length and diameter. That's why there's a huge difference when you're aspirating and when you're flushing. Right? Now, flush with the 10 cc. Let's see what you get. There you go. Go ahead and flush as hard as you can.
Oh, it's so hard.
Very hard. What's the max you're hitting?
20.
Did you hit? What was the max with this one?
It's always 60.
For you.
Oh, no, I didn't.
Let's try it. Okay, let's try it with the 3. No, aspirate from here. 28.
So it's more than this.
Yes. When you push it as hard as you can. Are we slamming these in our P's? Look, I've been in Children's National, Children ER, Pediatric and Adult ER. We don't flush it hard. Now, you can flush more gently with this than this. It is easier to flush more gently with the 3cc switch. But it's technique. Just don't slam it. If you slam it, you're going to blow that IV. Right? But yes. So this is how you're going to preserve your veins. How many times have you heard the floor complaining about ER lines?
All the time.
There's a reason why. Because they fail. So these are techniques we don't think about. Advocacy. Right? Flush. We're damaging these veins and we have no idea. We're doing a lot. We draw more blood, put in more IVs, infuse and flush more medications than anyone else on the floor. So there's more opportunities for damage from us. By the time it goes up, we've already done the damage. So I'm showing you these techniques, and this is good for you guys to see, okay, how hard am I really flushing? Right? Yeah. So these will be different techniques. This will let you see what you're inserting and how you're inserting. So let's take a look at this one. Anybody want to volunteer inserting?
Are you saying threes are better?
Go ahead, grab a seat.
Yeah.
No. It depends. Every catheter, every tool we use, every technique we use is dependent on treatment and patient. Is a 3cc syringe better for an adult?
Well, it depends on the vein. I find that when I I put a 20 in everything, minimum, because they can't get a CAT scan without a 20, unless it's Diffusics.
Right, so let me show you Diffusics. Why does Diffusics work? Does anybody know?
I love it. Hey, this is the hub or something.
All right, you're gonna pay attention to this because this is why these 22 gauges work and nothing else.
Yeah.
There's no other 22 gauge out there because they patented the design. This is a normal 22 gauge catheter.
Yeah.
Okay. This is why Diffusics can do CT if you put it in properly.
Oh, wow. It comes multiple angles.
There's holes on the sides to disperse the pressure. What happens when that CT goes in and pushes and slams that water? What happens? Have you seen those water jet flyers?
Yeah.
What's pushing it up?
Pressure.
Pressure and water. This is the same. It's going to propel your catheter out, but it's going to stay on your skin. You're going to anchor this down with glue. You're going to anchor it down with 300 pieces of tape, and it won't move from the skin, but it'll move outside of the vein, and we won't know that.
So this is my question then. Is a 22 Diffusics better than a 20 gauge?
It depends on why you're doing it. What are you using the Diffusics for?
What I'm saying is, like, CTs, put it at 20.
Go ahead and insert that about here. It depends. If your vein, if that 22 gauge catheter Diffusics is in a 24 gauge vein,
Well, I wouldn't do that.
it's not going to work.
No, I wouldn't do that.
Because you're still propelling it out this way. There's nowhere for the sides to go because it's being pressed by the sides of the walls. The only place that the fluid has to go is the lumen of the vein, the only space that's open. So now you're still going to propel it out and infiltrate. So you have to have the right catheter to vein ratio, which you can't really measure.
If a vein is big enough for a 20, do you
Yeah.
is a 22 Diffusics still better?
Yes. Why? Because there's more blood flow around that catheter. By the way,
He's not on the list.
try going here. No, sorry, didn't mean to fool you. You guys are good to go.
Still interesting.
Yes.
Right there.
Oh, nice. I can see it.
Hey.
Wow.
Wait, what are you saying?
That's a camera.
It's like
Can you see it?
Oh, so this is an IV camera?
This is an earwax camera. I use this to teach my clinicians why angle matters. So, pediatrics, you guys are working peds, right? I want you to take this catheter and I want you to put it on your hand and drag it at the angle that you normally insert at. And I'll get you some more catheters too. Hold on. How abrasive is that? Does it feel gentle? It does? I don't know. It feels kind of scratchy to me.
It's a little scratchy, but
You have scratch marks on your skin.
I'm trying to be gentle. I'm trying to be gentle.
So,
myself.
why is this so important? Do you feel that? Because even, this is why angle matters in helping our IV supply, especially for our pediatric population. This is key. I want you to watch this, right? So if you see the camera here, you can see the inside. Don't look here.
Oh.
This is where the action is.
Okay.
You guys are missing it. Come over here. Come on this side. So you're missing the action here. You see my needle? Okay. Let's say I'm in, but at a very high angle.
Oh my gosh. Oh my gosh.
Now, are you puncturing through? No. Is there permanent damage? No. But varicose triad, who remembers what that is? What are the three causes of thrombosis? Endothelial injury, hemostasis, and hypercoagulability. So endothelial damage is what we're doing. And so we wonder why our catheters fail. We're dragging and scratching the whole length. This is why I preach ultrasound. Why? Because if I can see where my needle is, I can now navigate my needle in catheters so I don't have to drag it. And now at that moment, does that look better than the first one? It doesn't look like it's digging in because the angle is lower. The Piper study with Peter Carr and Andrew Bulmer, they found that the higher your angle, the quicker your IV is going to fail. And it's not just angle of insertion, it's angle of rest. So if your catheter is resting at this super high angle, it's going to fail more likely to fail. Right? So this is another station you guys can practice and see what it is that you're doing. You want to go as shallow as possible with as much as possible. Now, I know our pediatric patients don't have loose skin. It's not much of a problem, but you guys work with adults. I'm pretty decently healthy. How many centimeters am I moving right now from here to here? It's like 1.5. Healthy skin. How much will it be for our elderly patient who lost 100 pounds? Right? So if you have this short catheter, and you guys have it shorter, it's like 2.1. That 2.1 should be illegal. The reason why you still have it is because our leadership keeps buying it. Right? Because they don't know this exists. So if I have 2.5 centimeter in and I'm moving 1.5, am I good? I have 2.5 centimeter in the vein.
Yeah.
So if I pull out, I'm still got a little bit left in. Now, what if I'm elderly and I have a 3 millimeter shift or a 3 centimeter shift? No matter how much you anchor it, the skin's gonna pull it out. This is why our IVs are failing as well. We don't have enough vein purchase inside of the vein. So that's the biggest difference. So get the longer catheter if you can. Does that make sense?
Yes.